Hi, I'm Juliet. I'm a GP with special interest in skin and a melanoma researcher at the University of Sydney, Australia. Today I'll go through some of the key components of our study that was recently published in the British Journal of Dermatology. It is well documented that people with a previous melanoma are at increased risk of developing another primary melanoma when compared with the general population. Previous studies estimate the risk to be on average 10 times higher, so this clearly indicates this is an at-risk group that needs to be followed up more closely. To date, follow-up guidelines for detection of new melanomas have been based on limited evidence and with little consensus. Our aim was to identify and better understand risk factors associated with multiple primary melanoma and therefore inform patient education and help tailor skin check schedules more accurately. We conducted a large-scale international systematic review and meta-analyses to investigate all risk factors associated with the development of multiple primary melanoma. Studies reporting a risk estimate, or raw frequencies, and conducted between 1982 and 2023 were included. 27 papers that included over 400,000 patients were selected and statistically analysed. Pooled effects were calculated using random effects meta-analyses to account for potential difference between studies. Adjusted risk estimates were prioritised over univariable risk estimates where they were coexisted. We identified several consistent independent risk factors, listed in order of our level of certainty as per the grade assessment. Most notably, the CDKN2A mutation and high nevus count were found to result in an increased risk of multiple melanoma. Secondly, the presence of atypical nevi and a moderate nevi count alongside increasing age were identified as risk factors too. Finally, male gender, family history of melanoma, lighter skin colour, first lesions occurring on the head and neck, inadequate sun protection were also identified as risk factors. These are also risk factors for first primary melanoma, although it was the patient factor rather than exogenous risk factors, such as the CDKN2A mutations and nevus factors that featured more predominantly in the multiple melanoma patients. Better estimates of personal risk and improved risk stratification can assist with tailoring surveillance, guiding the use of total body photography, and patient education. This research contributes to the body of knowledge regarding risk factors to multiple primary melanoma and the collective goal in determining optimal surveillance schedules based on personal risk, which firstly maximises the benefits of early detection, secondly may also improve quality of life by reducing anxiety about developing melanoma, and finally schedule appropriate timing of clinical visits without compromising patient outcome.